to see it. Well, there have been various care plans over the years. Some have been appalling and have not been accurate and insulting to both my daughter and myself. And there's loads of misinformation, and we've had verbal apologies, but nothing in writing, so it's still on her files. The latest one is being drawn up now, but the one before that we're still waiting to see. And it's not about confidentiality, because my daughter has no problems whatsoever with me seeing them. She has a dual diagnosis of schizoaffective disorder and Asperger's, so she's finding communication difficult. So she actually relies on me quite a bit at the minute to help her with this. So we are both waiting, and we've not had, and even after solicitors' letters and various assessments that were done of my daughter as well, psychological assessments and OT assessments, still not had a copy of. My daughter's not seen any of it, and neither have I. No, the last one, eventually the care coordinator sort of included us. He actually said on the phone, if you've got any ideas, would you like to discuss them with your daughter? So I spent a whole afternoon with my daughter going through stuff that she wanted, and and when we got to the meeting, here's one I prepared earlier, and didn't get a chance to even raise any of the issues that we discussed. So that was very disempowering, very disempowering. I mean, there is, my daughter is a fantastic artist. She suffers, like a lot of people with Asperger's, from acute anxiety. There is a program at Trinity Art College where there is somebody who specialises in doing assessments for people on the autistic spectrum in order that they can attend college, and not a single professional that I've mentioned this to has ever followed it up, ever. And that's where Aura could really benefit, is to reclaim her confidence around something she loves and enjoys. Yes, art therapy's been suggested, but even that doesn't seem to be on the cards anymore. It's sort of disappeared. It was mentioned at the last care plan meeting with the old care coordinator, and now it seems, well, not really sure. And well, I'd like to see what Ron Coleman, the voice hearer and now mental health trainer, calls it care and recovery. I'd very much like it to be much more based around self-management, recovery, getting the right support, alternatives to the medical model, not just drugs. I really find it very depressing that very often it's your relative's going to be on drugs for the rest of their life, and the panic about any thought of even reducing medication.